Today, we're diving into a really specific, powerful prescription drug called Gemfibrozil. Whether your doctor just mentioned it, or maybe you know someone who takes it, or you're just curious about how these medicines work, well, you're in the right spot. Let's get right into what makes this one so different.
So let's just start with the big question. We all hear about cholesterol, right? But there's another kind of fat in our blood called triglycerides. And what happens when their levels go from just high to, well, dangerously high? The answer is actually a lot more urgent than you might think.
To get why a drug like Gemfibrozil even exists, we first have to understand the problem it's built to solve. And it's a pretty serious one that can be building up silently inside the bloodstream.
And here it is, the critical danger. When those triglyceride levels just skyrocket, they can actually trigger pancreatitis. That's a sudden, incredibly painful, and potentially life-threatening inflammation of your pancreas. This isn't some far-off risk. It's an acute medical emergency that has to be brought under control and fast. Okay, so how do you fight back when those levels are getting out of control? This is exactly where Gemfibrozil steps in. Let's break down how this drug basically acts like a precision controller for your body's entire fat processing system.
So what is it, technically? Gemfibrozil belongs to a class of drugs called fibrates, and its main job, its whole purpose, is to fix the very specific fat imbalances we're talking about with a laser-like focus on those triglycerides.
So how does it do that? Well, think of your cells as these little factories. Gemfibrozil doesn't just storm in like a wrecking ball. Instead, it's way smarter. It goes in and flips the switch on the factory's manager, a little something called PPAR alpha, to completely change how the whole operation runs.
And once that manager is switched on, four really important things happen. First, obviously, PPAR alpha gets activated. Next, that fires up a cleanup crew that starts pulling triglycerides right out of the blood. Then it tells the liver, hey, slow down, stop making so many carriers for new triglycerides. And finally, as a nice bonus, it actually helps your body build more of the good stuff, HDL cholesterol.
So what's the end result of all that? Well, the main mission, the big win, is a huge drop in triglycerides. That's what lowers the risk of pancreatitis. You also get a nice little boost to your good HDL cholesterol. The effect on the bad LDL, though, that can kind of vary from person to person.
Now, this all sounds great, doesn't it? But here's the catch. Gemfibrozil is a specialist's tool, not a jack of all trades. So it is absolutely vital to understand who it's for, and maybe even more important, who should stay away from it.
This quote from the source material really just says it all. You have to get this idea out of your head that this is just another cholesterol pill. It's not. It's a highly specialized medication for very specific situations.
And the difference is actually pretty simple, but it's so important. This drug is for people with severe triglyceride levels, the kind that puts them at real, immediate risk for pancreatitis. It is not for just general run-of-the-mill cholesterol management, especially if things like diet and exercise could still do the job.
So for those patients who really do need it, the standard dose is 600 milligrams, and you take it twice a day. The key here is the timing. You want to take it about half an hour before your morning and evening meals. That's when it gets absorbed the best.
Okay, with any powerful medicine, there are going to be some powerful risks. We are now heading into the most important part of this whole explainer, the safety red flags. This is stuff you absolutely have to know, no exceptions. First up, let's talk about the more common side effects. Things you might expect, like an upset stomach, maybe some dizziness, or feeling tired, especially when you're just starting out. A lot of times these fade, but you should always talk to your doctor about them. But this is the single most important thing to watch out for. If you are taking Gemfibrozil and you start having unexplained muscle pain, soreness, or weakness, that is not something to just brush off. It is a major, major red flag for a very serious condition.
Let's be crystal clear. If you get that kind of muscle pain, especially if you also have dark urine or a fever, that is not a wait-and-see situation. You have to call your doctor right away. The other serious risks, like liver problems or gallstones, are exactly why your doctor will insist on regular blood work. It's non-negotiable. And that leads us right into the next critical issue, drug interactions. Because of how Gemfibrozil works in the body, it can have some really dangerous clashes with other common medications. So what should you never, ever mix with it?
The #1 most dangerous combo is with common statin drugs. Taking them together massively increases that risk of severe muscle breakdown we just talked about, which is why it's almost always forbidden.
It's the same hard no for the diabetes drug repaglinide. And with blood thinners like warfarin, the risk of bleeding goes through the roof, so it requires super close monitoring and usually a dose change.
And finally, let's just be blunt. There are some people who should not take this drug, period. If you already have severe kidney or liver disease, or you've had gallbladder disease in the past, this medication is just not a safe choice for you.
Okay, let's start to pull all this together. It's really easy to think of a treatment as just, take this pill. But with something like high triglycerides, the medicine is just one part of the solution. Your role in this is just as important.
That's because Gemfibrozil is what's called an adjunct therapy. What does that mean? It just means it's designed to help the main treatment. It's a powerful assistant, sure, but it is not a replacement for the real foundational work.
And what is that foundation? Well, it's all the things you'd probably guess. A good, heart-healthy diet, getting regular exercise, managing your weight, and cutting back on things like alcohol, which can directly spike your triglycerides. The pill just can't win a battle against a lifestyle that's working in the opposite direction.
And because of all those potential risks we discussed, especially to your liver and blood cells, that ongoing monitoring isn't just a suggestion, it's mandatory. Regular blood tests are the only way your doctor can know for sure that the medicine is doing its job safely.
So at the end of the day, Gemfibrozil is a really powerful tool, but it's a tool for a very specific job. Understanding what it does, what the risks are, and what your part in all this is, that's everything. And the final question, the most important one, is this: is it the right tool for you? And that is the critical conversation you need to have with your doctor.